I had a phenomenal, phenomenal experience with Dr. Baez, located in Santiago, Dominican Republic. Um, what I can say is that I didn't have any complications at all. Dr. Baez's bedside manner is awesome. If you call, he will be there. I want to say he went above and beyond as it relates to me and my experience. Um, Recovery time, the first 5 days was a little bit rough. I'm not gonna lie, but thereafter things get a lot better. The most painful aspect of it all isn't even the surgery. It isn't even just your body healing. It's the drainage massages. Now, they're necessary in order for your body to heal quickly and reduce the amount of inflammation that you have, but brace yourself because they're hard, okay? Um, I don't want you to worry about the facilities. The facilities were definitely modern. Everything was clean. Everything was professional. Everything was on the up and up. So there was nothing sketchy about the facilities at all whatsoever. So you don't have to worry about that aspect of anything. Um, I personally had a Brazilian butt lift done, and I also had gynecomastia removal. If you're not sure what that is, it is the development of breast tissue that happens right behind the nipples. Some men have it during puberty, other men have it after experimenting with steroids. In my instance, I experimented with steroids back in 2013, and as the years went on, what started as a little bulb got bigger and bigger and bigger until it was a whole gland that caused my chest to sit out and down like breast. You'll see the before and after photos in my actual review that I left on realself.com. But I had that removed, and I also had fillers put in my face to bring out my cheekbones. So you're looking at me now. So I'm going to go ahead and bring the camera on down so you can see the rest of my work. So let's start with the chest. As you can see, the chest looks fine. I've been working out. There's a little bit of asymmetry, but it's not that bad. And the only reason why there's scars under my chest are because my nipples are too small for glands that were about this big around to come out of. So they had to cut under the chest. As I work out more, I'm noticing that the symmetry is coming back into formation. But I'll probably end up getting a tattoo anyway, just to cover all of that up. My waistline. What I have noticed about my waist is that I don't accumulate fat around my waist like I used to. Um, I don't know. Maybe it's because of fat removal. I'm not exactly sure, but my waistline is a lot slimmer than what it typically is. Um, I'm going to show you the puncture wounds for the cannula. The cannula is the instrument that is used to remove fat and or put fat back in you. So there's a dot there, there's a dot there, there's one in my belly button, there's one right here. I want to say they removed fat here, they removed fat here, and if you look at the very top of my butt, you can see one there, and you can also see one there, and I want to say there's one right above my butt crack right there. Um, Now, if you put the proper ointments on them, they'll lighten up considerably. I didn't have that time, and I didn't really care, so I didn't. However, if you are worried about scars and incisions, go ahead and put that Neosporin or Mederma, whatever you want on it, and it'll lighten up a lot more than what mine did. So I guess I'll show you the butt now. That's what everybody wants to see. That's the money shot. So as you can see, goddamn, look at her. Ain't she doing it? Look at that. It's a work of art. I do declare. So, like I said, my recovery was easy breezy, beautiful cover girl. The first 5, 6 days are rough, but thereafter, things get a lot better. Now, depending on how big you are, you may notice an immediate change in your waist, depending on how much fat you had to remove and how much fat he actually put in your butt. I was not a huge obese person. So when I first came back, I was like, wait a minute, my waist isn't as snatched as I would like it to be. But I noticed over the months, the waist came into formation as the swelling went down. When you immediately arrive back, you will notice a lot of swelling. But again, like I said, this is 6 months out. 6 months out, there is literally no swelling at all whatsoever. And everything's great. His staff was awesome. His staff was friendly. Now, if you're an American speaking person, you may have some interactions with the staff where there's a communication barrier. However, as it relates to Dr. Baez himself, he has an excellent handle on the English language, so you're not going to lose anything in translation as it relates to him. He speaks enough English, he speaks well enough English for you guys to come to a consensus, for him to set proper expectations as it relates to what you want, what you're trying to look like, what the pre-procedures are going to be, and what the post-procedures are going to be. So do not worry about that. I want to encourage you all to take control of your life. You're going to have people that tell you, don't do it, oh, you're fine, don't do it. Forget them. Do what makes you happy. If you have the financial means to do so, and if you want to feel better about yourself, if you're doing these things for the right reason, I encourage you to do it. Do it for you and only you and no one else. Because nobody can tell you what you're supposed to. When you look in the mirror, you have to worry about what you see in that reflection, okay? Nobody can tell you what you're supposed to look or what you're supposed to feel like. You do these things for you, all right? So I'm going to do one more spin, and then I'm going to get out of here. There we go. Like a beautiful ballerina. Yes. All right, everybody. I'm going to go now. Bye.